It's an honor to speak to all of you. Unfortunately, Brazil is clearly not doing as well as Israel or Chile. And unfortunately, the people responsible for this are not here to be accountable. So I'll have to be the face of the country for now, at least. Thank you very much. I'll share it quickly my screen here for a brief presentation. As Professor Levy so eloquently put it, we basically have three strategies for any vaccination, but particularly for this virus. So we can either use the whole virus, and we are doing some of that in some vaccines here in Brazil. Parts of it that's being done first by some other vaccines initiatives that we have here, using either an adenovirus as the main carrier, or now the Newcastle virus with the spike protein on a new initiative. And of course, the front runners and the deers of everybody, the vaccines using genetic material, mostly Moderna and Pfizer, which are already approved, but also CareVac is on the fast track to being approved, and it's another one with a very interesting, promising on this side of the genetic vaccines. We have to recall that mRNA vaccination is not a new thing. It has been used in autoimmune diseases and in cancer for the past 20 years, at least in animal models. So that's one of the things that certainly accelerate the possibility of using it now. And again, as Professor Levy said, support to science always pays off. And we are trying to get this through here, but it hasn't been that simple. If we look at the candidate vaccines, what we have, and I updated that at the beginning of April 2nd, we have 63 vaccines worldwide being tested in some sort of clinical phase, and 179 in preclinical research. They are divided in several different dose distributions, and in those three main categories there. 7 of those 179 that we have in development are being developed here in Brazil, although I obviously cannot spell Brazil, it's missing a Z there. But we hope to have at least 3 of them in phase 1 yet this year. That should help out specifically because, as you are fully aware, we have had a slew of variants here in Brazil, and we clearly don't know how the standard vaccines will work against our variants here. That will certainly be spread throughout the world, not because we are traveling that much, but as you know, the virus doesn't respect boundaries, so it will certainly continue to mutate elsewhere as long as our zeros are above 2.5. So if we take a brief look, and this is from 2 days ago on deaths per million of people. Unfortunately, Brazil is being the champion from now. We have been growing significantly in the past few weeks. We achieved 4,200 deaths per day yesterday, which is certainly not a nice record to achieve. Other countries are doing much better. Some of them, like the United Kingdom, clearly have a decrease associated with a wave of vaccinations, and we'll see how that will do here whenever we can vaccinate more than 30% of the population, which is a hefty goal considering that we have 240 million people living in Brazil. If we look at new cases per million, again, if you look at the case of the United Kingdom, certainly the vaccination has been very effective there. Brazil is showing a decrease in the last week, which is very welcome by all of us because ICUs are certainly full here, and if we don't decrease on the number of infected people, there is no chance we'll be able to control this and avoid the catastrophic end that we saw in the Lombardia, for instance, in Italy and in other places in the world. But nevertheless, this cannot be considered an effect of the vaccines here. We haven't vaccinated enough people, and that's where we sit right now. Clearly, the champion is Israel, but again, United Kingdom is doing very, very well. And our neighbors in Chile, as a good example for the whole Latin America, are doing well too. The United States, since they changed the command and could even put a drop there and look at how the curve has accelerated different between January 20th and now. and my kids live in the United States, and they were all vaccinated, while the old man here, although I'm in the front line, just got vaccinated a month ago. And then we have a bunch of other people with the same numbers as Argentina and South Africa, India, who is having problems right now. Just yesterday, they broke the barrier of 100,000 people infected or confirmed infected in one day. So that it's a new hotspot that is of concern. So this is a brief overview of how the situation is in Brazil and worldwide, how we compare. We are really looking forward on the 7 vaccine initiatives that we have here, principally on the street, that we should start clinical trials still this year. There is one that we should hopefully start in May using the Newcastle virus. And that's what I had to tell from Brazil. I wish I had better news, as Professor Levy brought from Israel, or as our colleagues in Chile will probably be reporting soon. But that's the situation as it is. And there is a famous phrase that you can avoid acknowledging reality, but you cannot avoid acknowledging its effects. And now we are on the effects phase of not acknowledging reality. Again, thank you very much, Diego and Johnny, for inviting me. And I'm at your disposal if there are any questions.